Good afternoon, everyone, and welcome to the final webinar in this series. It's very fitting that this final webinar is about fasting, as we celebrate the 60th anniversary of the Natural Health Society. When our organisation started 60 years ago, fasting was very unorthodox. Fasting for self-healing was one of the principles that made us unique. While fasting is often in the media these days, there are still a lot of myths and misconceptions around it. Today, we're honoured to have someone who knows as much or more about therapeutic fasting than anyone else in the world. Dr. Alan Goldhamer, DC, is the founder and director of True North Health Centre in California in the USA. True North is a state-of-the-art facility that provides medical and chiropractic services, psychotherapy and counselling, as well as bodywork. Dr. Goldhamer is also director of the centre's groundbreaking residential health education program. Dr. Goldhamer has supervised the fasts of thousands of patients. Under his guidance, True North has become the premier training facility for doctors wishing to gain certification in the supervision of therapeutic fasting. Today, we're looking forward to Dr. Goldhamer answering the question, can fasting save your life? Thank you, Dr. Goldhamer.
Well, it's certainly an honor to be here. And it's fitting, too, considering I started this whole process in Australia, training with Alec Burton in 1984. So I'm assuming that those slides are coming through okay now? Okay. So I think a good place to start really is this concept of life expectancy versus healthy life expectancy. You know, everybody wants to live a long life and live, you know, as long as your capacities allow. But what people forget is that living long is important, but living well is also important. So, you know, if people spend many years disabled, a longer life becomes less appealing. And the reality is that there's been 109 billion modern humans born on the planet. And there are 7.7 billion humans alive today. But there's only been well-documented evidence that 5 individuals have lived past 117. So we can speak with pretty good confidence that you're likely to live less than 117 years. The odds of living more than that would be about 1 in 20 billion. So if we look back in 1900, life expectancy in industrialized countries was about 47 years old. Today it's 78. Interestingly enough, you notice it's gone down in the last few years for the first time. But anyway, that increase is 31 years. But adults live only 7 years longer than they did in 1900. So you have to ask, where is the difference? Where is that 24-year difference? And the difference is made up largely because even though adults aren't living longer, we're not killing off infants in infancy as much as we did. So although infant mortality was about dramatically higher in 1900, less than 6 or 7 per thousand today. And so that reduction is responsible for the vast majority of increase in life expectancy. In fact, if you look at this chart, you notice that the 47 years increased by 24 years, almost all of that increase, that 24 years, is a reduction in infant mortality. Only 7 years is every other variable combined. So the vast majority of reason why people have an increased life expectancy is because babies are not dying, not because adults are living longer. Interestingly, in the United States, we spend 2.5 times as much money per person on healthcare as they do in many other countries. But the United States folks are not living longer and they're not living better. Healthy life expectancy in Australia is higher than the United States, even though Australians spend, you know, fractional amount of money per person. So the key may be not so much how much money you spend, but on where those efforts are focused. Life expectancy is the amount of time a person born today can expect to live. Healthy life expectancy is the time an individual born today can expect to live fully functional. And the fact is, although life expectancy is 78, healthy life expectancy is only 69. The average person is spending 9.4 years debilitated and 17 years in poor health. It's reducing this debility and these years of poor health where diet and fasting have the greatest promise. Right now in the United States, and I think largely in Australia, leading causes of death are heart disease, cancer, and stroke. But the actual causes of death, the reason people get heart disease, cancer, and stroke are tobacco, alcohol, and animal-based refined carbohydrate-dominated diets. So it's likely that if we want to see better bang for our buck on healthcare dollars, we need to shift from spending billions of dollars treating the leading causes of death, heart disease, cancer, and stroke, to treating the actual causes of death so that people don't get heart disease, cancer, and stroke. If you look at this chart, you notice that tobacco is number one. When it comes to premature death and debility, nothing works better than tobacco at killing people prematurely. Elevated blood pressures are a close second. Use of alcohol, a close third. Interestingly enough, alcohol is often trying to be promoted as if it was some type of health food. You know, there's resveratrol in wine, so you should drink wine, that it thins your blood like aspirin, so you won't have a clotting stroke. What they don't tell you is that you actually don't have a reduced risk of dying because you drink alcohol. You just have a reduced risk of dying from the type of stroke. In other words, you have an increased risk of a bleeding stroke, but a decreased risk of a clotting stroke. That's not exactly health food. Elevated cholesterols are an important all-cause mortality issue because they predict how much animal food you're eating. Being overweight, not eating fruits and vegetables, physical inactivity, illicit drugs, and unsafe sex. These are the reasons people are actually dying, and these are the things that we have to be focused on if we want to actually make a change. Right now, both United States and Australia, the metabolic syndrome is actually the leading epidemic disease. If your waist circumference is greater than 35 inches in women or 40 inches in men, if your triglycerides are over 150 milligrams per deciliter, if your blood pressure is over 130 over 85, if your blood glucose is elevated, your blood HDL is low, if 3 or more of those factors take place, you have what's called metabolic syndrome. And metabolic syndrome has become epidemic. And it's associated with everything you see here on the chart, from liver and colon cancer to gout to diabetes, stroke, congestive heart failure, myocardial infarction, coronary artery disease, non-alcoholic fatty liver, and others. This is the thing that's killing people today, this metabolic syndrome, including, I might mention, vulnerability to infectious disease, including COVID-19. If you look at who dies from COVID and who recovers, one of the big variables is not just age, but metabolic syndrome, overweight, diabetes, cardiovascular disease, et cetera. And boy, we are getting fatter. There's no question about that. In 1986, this is just a chart in the United States, but you notice that there wasn't a single state in the United States that had over 14% obesity saturation. And yet, here we are in 2020, and we just keep getting fatter by the day. We have to have new colors on the chart here because we've achieved such a high degree of obesity saturation in many parts of the United States. 2/3 of people actually in industrialized countries are now overweight or obese, and visceral fat is particularly a concern associated with inflammatory markers and increased risk of heart disease and diabetes and stroke and breast cancer, colon cancer, and Alzheimer's disease. So many different conditions are associated with increased visceral fat, and visceral fat is caused by poor dietary choices. Diabetes, increasing geometrically on both continents, especially amongst children. If you look at the correlation coefficients between obesity increase and diabetes increase, the correlation is almost 1-to-1. It's quite clear that there's a connection. So what they're doing in many countries is encourage people to eat health foods. But what they call health food is olive oil, red wine, dark chocolate, coconut products, white meat, and dead Dr. Atkins paleo-type diets. These high-fat, high-protein diets that, although may have some short-term gain in terms of short-term weight loss, may not be healthy in terms of their long-term consequences. What we should do, in my opinion, is be encouraging healthy foods, not health food, but healthy foods. So that would be fruits and vegetables, grains, legumes, nuts, and seeds, a whole plant food diet that's free of salt, oil, and sugar, or what we call an SOS-free diet. SOS, of course, is the international symbol of danger, and it stands for salt, oil, and sugar. So What about fasting? Fasting has gained, as was mentioned earlier, quite a bit of notoriety. It's gone from being criminal quackery to cutting-edge research. Intermittent fasting is discussed frequently in the media. The idea that if you narrow your feeding window, the number of hours a day which you eat, you may reduce overeating and obesity. In fact, at our clinic, we recommend an 8-hour feeding window for all patients. That is, they limit their feeding between 8 hours and they have a fast between 16 hours every day. Basically, what that comes down to is making sure you don't eat 3 hours before you go to bed at your normal bedtime. There's also programs where people will do fasting mimicking diets. They'll reduce calories for a number of days and do other types of intervention. But what I'm going to be speaking to you about today is not fasting mimicking programs, but actual fasting. Fasting up to 40 days on water only. And fasting is the complete absence of all substances except water in an environment of complete rest. I'd mention right off the bat, long-term water-only fasting needs to be done after there's been a proper history exam lab and appropriate monitoring. It's not for everybody. Patient selection is really important. Medical history, there's many conditions in many individuals that wouldn't be good candidates for fasting. Fasting could be a serious consequence. Physical examination is necessary to establish baseline data so you can tell the difference between a good thing and a bad thing that can occur during fasting, a good thing where there's a healing crisis, a bad thing where there's problems, and it does require laboratory evaluation in order to be able to monitor people effectively. Some people that should not fast would include people that are pregnant or lactating. If you fast when you're lactating, of course, you'll lose your milk production. Conditions like anorexia nervosa and type 1 diabetes are not good candidates for water fasting. Type 1 diabetics don't produce insulin. They wouldn't be able to adapt to the fasting process. If you've had a stroke or myocardial infarction, or pulmonary embolism or DVT in recent times, if you have cardiac instability or atrial fibrillation, fasting is not for you. If you have severe kidney disease, the kidneys are necessary to adapt to fast in order for the body to process the materials that are elaborated. If your kidney disease is too severe, you'll shut those kidneys down. That would be a problem. There's some genetic conditions like porphyria or medium chain acetyl coenzyme A dehydrogenase deficiency, MCAD, which would contraindicate fasting. You wouldn't be able to adapt to the fasting process. If you have deficiency, depletion, cachexia, or inability to discontinue certain medications, fasting would not be for you. Conditions that are favorable to fasting, not surprisingly, are the conditions that are caused by dietary excess. So obesity, elevated blood lipids, high blood pressure, cardiovascular disease, type 2 diabetes, cancers like lymphoma, GI imbalances, autoimmune disorders, dependence and toxicity issues. These conditions are made worse by poor dietary choices. It's not surprising that when you give the body a chance to fast, the consequences are rapidly reversed. At our clinic at the True North Health Center, we fast patients from 2 to 40 days. Now, there has been a history of fasting people even longer than that. We don't do that. The reason is when I came to Australia in 1984, Dr. Burton, who was at the time the world's most experienced fasting supervisor, told me he was no longer fasting people 60, 80, 100 days. And I asked him why, and he said because of sleep deprivation. And I asked him, I said, do you mean to say that when people go on very long fasts, they lose the ability to sleep? He said, no, not the patients, me. Because what would happen is he would worry too much as people got into that more delicate balance. If you keep the fasting periods shorter, there's less complications, less electrolyte imbalances, other challenges. So in our clinic, we've made a rule that we will fast up to 40 days, but we try not to go over that. The average patient is fasted 1 to 3 weeks. Some patients will require multiple fasts in order to resolve problems. This is data that came from a new research device that we have. It's a DEXA scanner. And what it does is it allows us to do whole body composition analysis. And this was really important study that we are conducting because in the past, people would notice they would lose weight fasting and they would regain it. And they would assume that the weight they lost was the weight they regained. And what we found was actually that's not the case. When you fast, you can see here from this graph, the magenta is fat-free weight loss, and the black is fat loss. So when people go on a fast, they lose both fat and muscle, water, glycogen, and fat. But when they recover, the fat continues to go down, but the muscle, glycogen, fiber, and water are what recovered. So you lose fat during fasting, you regain muscle, water, and fiber, but continue to lose fat during refeeding. In fact, we're in the process right now of doing a large study looking at this, and that's exactly what we're finding, is that not only is fat lost during fasting, but visceral fat is preferentially lost. So in this case, this study, you see 22% of visceral fat was lost, but 41% of total fat was lost. And during refeeding, 41% of total visceral fat was lost. So they lost visceral fat during fasting. They continue to lose visceral fat on recovery. And in fact, visceral fat is mobilized preferentially to even adipose tissue. So the very kind of fat we're most concerned about, the visceral fat, the fat that accumulates around the organs and in the abdomen, is mobilized at an even faster rate than general body loss of fat. In fact, you can see here is a different graph. Weight loss, fat loss, visceral fat loss, and very little lean tissue. So that this technology is allowing us to really take a look at what actually happens to the body. A larger percentage of visceral fat was lost compared to subcutaneous fat at the end of a fast. Loss continued through refeeding. No other methods identified to date result in such a large percentage of visceral fat loss, and we are in fact conducting additional research. High blood pressure, leading contributing cause of death and disability. High blood pressure is responsible for, in the United States, about 5.6 million people associated with congestive heart failure. 287,000 die from it. Blood pressure is the major preventable factor in congestive heart failure. And about 800,000 people in the United States die from strokes each year, and again, high blood pressure is the reason. If you get rid of the blood pressure, you largely reduce the risk for these issues. 40% of people over 25 in industrialized countries are now hypertensive. And 63% of people over 60, which means if you're over 60 and you don't have high blood pressure, you're abnormal. You're actually abnormal. The normal or average person now is overweight, and the normal average person has high blood pressure by the time they reach 60. Blood pressure is worth a lot of money to the medical profession. It's the biggest justification for prescription medications. But the majority of people that actually have heart attacks and strokes from high blood pressure have blood pressure that's not actually high enough to justify the risk of medication. You might ask, well, if so many people are overweight and have high blood pressure, why don't we just give everybody blood pressure? Why don't we just put it in the water supply if it's so common? And the reason is blood pressure medications are actually very dangerous. And that unless your blood pressure is elevated to a certain level, you are more likely to die taking the blood pressure medications than you are from the blood pressure itself. For example, if your blood pressure is 138/88, you have 5 times the risk of having a heart attack, but your risk of dying from taking blood pressure would exceed the benefit. So they will not give you blood pressure medications until your risk factors rise even higher. And for every point you'd reduce your blood pressure by 1 point, there's a 1% reduction in all-cause mortality. And that risk probably goes down to 90/60. So even at 120/80, which is considered average blood pressure, you still have a significant increased risk of all-cause mortality than if we allow your blood pressure through diet and lifestyle change to be lowered to a healthier level. This is how we treat blood pressure. And unfortunately, it has a lot of secondary effects. Although you can slightly reduce the risk of stroke by lowering systolic blood pressure, the side effects include chronic cough, fatigue, and impotence. And one of the most important things is, your doctors will admit, if you ask your doctor, how long will I have to be on these blood pressure medications, they'll tell you forever. Forever. You'll be on drugs the rest of your life because they're guaranteeing you you'll never get well. You'll be on medications till you die because they know the medications have nothing to do with getting rid of the reason why you have high blood pressure. They're just trying to manipulate physiological mechanisms so that they can lower the numbers. So if you go on blood pressure medications, they're guaranteeing you that you will be sick forever. This comes from a major cardiology website. It says that people with hypertension can't be cured because there's no underlying cause for the high blood pressure. So there's nothing that can be fixed. Well, nothing could be farther from the truth. If we look at a number of meta-analysis, we can see that weight loss, high-fiber diets, not drinking, exercise, and drugs, as well as sodium restriction and vegan diets, are all variably effective at treating high blood pressure. The drugs, of course, work to lower pressure, but they cause chronic cough, fatigue, impotence, and premature death, so we have to use those with some caution. You'll notice salt restriction here is actually more effective on average than medication at lowering blood pressure, and the combination of diet and low salt and exercise work quite well. This is when you add fasting to the mix. This is a study we did with T. Colin Campbell from Cornell University with 174 consecutive patients. We were averaged to get an average drop in stage 3 hypertension of 60 points. This was a paper published in Journal of Manipulative and Physiological Therapeutics some years ago. And if you look at these people here, severe high blood pressure, people who start at 180 or above, their average effect size, was 60-point drop. That's the largest effect that's ever been shown. If they started with more moderate levels of hypertension, the results are proportional. This was a second paper we published looking at borderline hypertension, people where they weren't high enough to justify medication, but they were still at increased risk of dying as a consequence of elevated pressure. And not surprisingly, they responded equally impressively. 68 patients with borderline hypertension, fasting from 5 to 40 days, and all of these patients were able to normalize their blood pressure without the use of medication. We were actually approached by one of the big labor unions, and we ended up doing a study with them. We took the first 30 consecutive patients. They were with us 3 weeks. They dropped 26 pounds in 3 weeks, dropped their blood pressure 30 over 11. At 1 year follow-up, they were down 28 pounds and had maintained much of the pressure. What was exciting to the union is they saved more money in the first year just in reduced medical costs than in the entire cost of the program. So that we went on for over a decade working with this union. We treated over 100 of their members, and the results were really quite gratifying. I do remember, though, the very first member they sent me from this union. These are crane operators. These guys are, building your highways and whatnot. And they sent this guy in, and they said, look, your blood pressure is 220/120. You're capped out on meds. You can't work until you get your blood pressure down. And they sent him into True North Health Center, but they didn't tell him what the program constituted. They just said, you got to go to this place. And they thought, he just thought he was going to get a 6th medication. Shows up, looks around our place, and he's like, oh, I don't think I'm in the right place. I said, no, you're on. I got your name right here on the list. You're in the right place. No, it's not me. I said, no, it's you, all right. And he said, no. I said, no, you're here to get well. He says, I'm not sick. So what do you mean you're not sick? Your blood pressure's capped out 220/120. You're on 5 meds. You're not only sick, you're going to die. He said, yeah, well, aren't we all going to die? And I, good point. And so then I said, well, all those medications, I was thinking about it as, medical history. And I said, if we'd get you off all those drugs, you could save over $800 a month in medication. And he said, well, what do I care? He says, my union pays for the drugs. I don't have to pay for any medication. I wasn't sure what to do. And then I was thinking about his medical history. I said, you're on all those medications for high blood pressure and diabetes. You got this problem. You got this little, problem. Yeah. So with the impotence. So I said, if we do something about get you healthy, I might be able to do something about your, little problem. Well, then he starts to stand up, and I'm thinking, yeah, that may not have been a good idea because he's a pretty big guy. And he says, well, why the hell didn't you just say so? So anyway, we're talking a little bit now. I've got his attention. And he tells me his diet diary, and in his diet history, this is what he ate: triple cheeseburgers. But you see this green stuff here? If they made a mistake in putting any of that on there, he'd take that off and throw it away because he just thought that lettuce was disgusting. So we decided, okay, before we start fasting this guy, we're going to have to get some food into him, some real food, not just triple cheeseburgers. So we started giving him some food, some salad, some vegetables, and he's trying to eat the food, but he's like, can't swallow it. He's like, and I'm thinking, I don't know, maybe he's got a tumor or something. I asked him, I said, what's the problem? It looks like you're having trouble with the food. He said, what food? He said, this is not food. He said, this is disgusting, tasteless swill. He said, if I have to eat stuff like this, I'd rather just die. He says, why don't you go out to my truck and get my 12-gauge shotgun And when I'm not looking, just shoot me in the head. So we checked him in. He ended up fasting 26 days. He lost 50 pounds, normalized his blood pressure. We got him off his medications. What was interesting, after the fast, we were feeding him real food, but now instead of choking on it, he was actually eating it. And I said, it looks like you're doing better with the food now. He says, yeah, your damn chef's finally getting the hang of it. But it took me 20 minutes to convince him it was the same food. But he had adapted to the changes with the fasting, and now he's able to eat. I saw him 6 months later at a union screening where we do blood pressure screening. I said, how you doing? He said, I'm doing just fine. And that's not an unusual example where fasting can be so helpful. If we just said, go home and eat a good diet, it wouldn't have lasted a meal. But after he'd gone through the fasting process and you're adapted, he was able to make that transition. So the question is, okay, so these guys can get better fasting, but is it safe? Is it really safe to have a person go for a week or a month or 40 days on water only? So to answer that question, we conducted a study, a fasting safety study. A chart review of adverse events during medically supervised fasting was published in BMC Complementary and Alternative Medicine in 2018. And in that study, we used the common terminology criteria of adverse events, the CTCAE definition. Any abnormal clinical finding temporally associated with the use of therapy was reported. Didn't have to be causally associated. And all the symptoms of all the patients for 5 years were classified as grade 1, 2, 3, 4, 5. So grade 1 is mild. So you have symptoms, might be low back pain, or you might get some irritation. Number 2 is moderate. You might have skin rashes. You might have other problems. Grade 3 are more severe or medically significant. For example, anytime a blood pressure goes over 160, that's considered a grade 3 event. Grade 4 are life-threatening. These could be electrolyte imbalances or something that requires urgent medical intervention. And then grade 5 is the easiest to rate because that's death. So if you die, you get a grade 5 that day. If you have a serious life-threatening consequence, you get a grade 4. If you have a grade, severe medical sick, you get a grade 3, etc. And so every patient was evaluated every day for 5 years. And those were correlated. We had 5,949 what are called adverse events. 4,482 were these mild or moderate. These are things that you expect to happen during fasting, like foul taste in the mouth, the headache, the withdrawal from the caffeine, etc. There were 310 what are called severe events, and a third of those, interestingly enough, were hypertensive crises, that is a blood pressure over 160. Now you might ask, why would a person on a fast have their blood pressure go up over 160? Well, the way it works is if they come in like our union guy and they start at 220, and the next day they're at 210, and the next day they're at 200, and the next day they're at 180, and then 170, and 165, every one of those days is an adverse event. Even though they're getting better, it's clearly coming down. Anytime blood pressure measures over 160 has to be recorded as adverse event. So a third of these adverse events were actually people with hypertension that were recovering. There was only one category 4 event, and this was a person whose sodium went too low, so we had to put intravenous fluid on them. They took a bag of fluid, they were fine, it wasn't any consequence, but it could have been, if you didn't recognize it, it certainly could have been. And there were no deaths. So no deaths, one, electrolyte issue, and then, numerous expected consequences. The conclusion of this study was that the majority of adverse events are mild to moderate. They're expected and known to occur during fasting. There was a slight correlation between age and adverse events, but not severity. This was very important. Up until this study was done, it's the first one in the world that was done on this, anybody over 65 was considered too old to participate in the study. And now we know that there's no increased severity just because you're, say, 75 or you're, versus 45. And so now human subject committees can approve fasting for people that are older, even over the ancient age of 65. So that was important. Physiological effects of fasting. So what happens during fasting? How is it possible that doing nothing, fasting, can work better than doing just about anything at treating so many conditions that cause people to be sick and miserable? Well, guess what? When you don't eat, you lose weight. You lose about a pound a day. And obviously, if you're eating nothing, you're going to lose more weight than if you're losing anything. And what's really interesting about fasting is that much of the net weight loss ends up being fat, and particularly visceral fat. It's probably the most efficient way of reducing visceral fat that's been discovered. For example, compared to a keto-type diet, the ratio is significantly higher for mobilization of visceral fat. Fasting also gets rid of excess salt in the body. And the salt is associated with retinal fluid, which increases blood pressure and blood volume, and it causes edema and swelling and interferes with all kinds of processes, including the microbiome in the gut. Well, in fasting, the body rapidly immobilizes sodium and it flushes it out of the system. Blood volume drops, blood pressure normalizes, congestive heart failure starts to reverse. Traditionally, detoxification was why people fasted. The idea that there were toxins in the body. You go on a fast, the body mobilizes those toxins, gets rid of them. Turns out that's true. And in fact, fasting is a very efficient way of getting rid of both endogenous toxins and endogenous toxins, internal ones like normal, cholesterol and built up fatty materials, and exogenous PCB, dioxin, pesticide residues, all that. Both of those are mobilized and eliminated in fasting. Enzymes are induced. For example, you can't mobilize fat without going through lipolysis. That's an enzymatically driven system. When you fast, you induce those enzyme systems and you actually get better at it. Every time you fast, those enzyme systems persist. And that may be why when people fast every day for 16 hours with intermittent fasting, or occasionally fast for a week or two or a month, they get better and better and more efficient at mobilizing these fat mobilizing systems, these carbohydrate glycogen mobilizing systems, and these detoxifying pathways. So we believe that there's a training effect, and that may be why doing it every day and occasionally for a longer period of time may result in so much benefit. You do this in animals. It's interesting. With rats, you use periodic fasting, you double their lifespan. They literally live twice as long as when they're fed ad libitum. Insulin is a hormone. It drives sugar from the bloodstream into the cells. When that doesn't work, we call it diabetes mellitus. And so what fasting does is it reduces insulin resistance. Type 2 diabetics actually make more insulin, not less. It just doesn't work. Fasting gets it working again, which is probably why around 80% of our type 2 diabetics are able to achieve normal blood sugar levels without the use of medication. So you can actually reverse this process. The gut is a tunnel. It goes through the body. And in the gut, there's 5 pounds of bacteria, 5 pounds of creatures. That's 1 trillion organisms. Living creatures living in your gut right now. In your gut, you have 5 pounds of creatures that are eating and drinking and defecating inside you right now. And what your microbiome poo in you depends on what you feed them. If you feed your microbiome animal food like meat, fish, fowls, and dairy products, they're going to be pooing products called trimethylamine oxidase in you, which becomes irritating to the vessels and leads to heart disease and cancer and other problems. If you feed your microbiome soluble fibers like sweet potatoes and vegetables, they're going to be pooing fertilizer in you. They're going to give you vitamin K and all kinds of stuff that you need. So you want to make sure you feed your microbiome a whole plant food diet, and then your microbiome won't poison you. When you fast, it's like rebooting the hard drive in a computer. You can reboot that whole microbiome, and then when you go after the fast and eat properly, we believe that you can reestablish a normal, healthy gut microbiome, which is important for your protection, including from things like infectious disease. So the gastrointestinal tract is actually a tunnel. It starts in the mouth. It goes through the esophagus, into the stomach, the small bowel, the large bowel, and then eventually stuff reaches the hole at the other end through the rectum to the anus. So if you think about it, digestion is essentially shoving stuff in one hole and then trying to push it out the other hole. And nothing that you shove in your mouth gets absorbed into your body unless it gets absorbed through the intestinal mucosa that is represented here by like a screen. And the holes are very small. Nothing gets through except amino acids and glucose and essential nutrients. No large bacteria or peptide molecules can get through unless the screen is damaged. It works much like the screen here works to keep the fly out. If the holes are small enough, nothing gets through. But if the screen becomes damaged, then what can happen, if it's a screen, the flies get through. If it's your gut mucosa, proteins can leak through, bacteria can leak through, a process called gut leakage. And when they do that, at first your immune system will react to it and neutralize it. But eventually, in genetically vulnerable people, it can become a problem to where your immune system becomes confused and may begin to attack its own tissues. and that's called autoimmune disease. Autoimmune disease is essentially your immune system attacking your cells. That's what rheumatoid arthritis is, your immune system attacking your cells. And one of the triggers appears to be gut leakage, which can be caused by free radicals. Like you see here, which half is the smoker? Can you tell? Yeah, you can tell this is the smoker. They call it smoker's face because you have all those wrinkles, and wrinkles are nothing more than cross-linked collagen tissue. It's premature aging that occurs from exposure to free radicals. And for example, when you smoke, you bathe the body in free radicals, and so you get this really interesting smoker's face. Whereas if you don't smoke, the person the same age would have a slower aging process. Well, that process also occurs in your blood vessels. That's why smokers get so much heart disease. In fact, some people might argue that smoking protects against lung cancer. And when you think about it, it's true. When you smoke, you have such a high risk of heart disease that only 20% of smokers live long enough to get lung cancer because they die from heart disease before they can grow their tumors. So I guess if you could make smoking even more dangerous, where everybody died prematurely from heart disease, they'd probably start trying to advertise it as cancer safe, wouldn't they? Okay, this autonomic nervous system is the part of your nervous system that controls what you don't think about. Like, for example, if you go out running and your heart didn't speed up, you would die. How many people die because they forget to tell their heart to speed up? Nobody, because the heart does it automatically. And the thing that makes the automatic nervous system work is the autonomic nervous system, which has two parts, sympathetic and parasympathetic. And they work in contrast and balance to each other. The problem is your autonomic nervous system can become unbalanced, and we try to rebalance it. That's what all our natural healing systems are: massage, chiropractic, manipulation, physical therapy, yoga, meditation, homeopathy, acupuncture. All these things work to the degree that they help balance the sympathetic nervous system and parasympathetic nervous system. I think the most powerful way of rebooting the autonomic nervous system is with fasting. It's like rebooting the hard drive in a computer. It's fabulously effective. And that may be one of the reasons why so many of these pain syndromes respond so well to fasting. Psychospiritual. Isn't it interesting that the Jews, the Jains, the Hindus, the Muslims, the Christians, all these people, they disagree on so much. Some of them are killing each other in the streets over their religious differences, but they all have one thing in common. They all have a tradition about fasting and how fasting can help change how people feel about themselves and the world around them. The immune system is enhanced during fasting, not suppressed. So things like autophagy, the body's ability to eat up cancer cells and clear out debris and tumors and the rest, are enhanced. In fact, recently, on 2016, the Nobel Prize was actually awarded to a gentleman that actually has been studying autophagy, and the impact that fasting has is quite profound. Fasting is a big effect on taste adaptation. I already told you the story about my union guy who went from thinking the food was tasteless, disgusting swill to not bad. And that was an example of adaptation, taste adaptation, where good food changes from being terrible to being good because he got free of his addiction to the artificial stimulation of chemicals, including salt, oil, and sugar. So our data suggests that there's a decrease in the liking of salty, fatty food and sweet fatty foods as a result of fasting. We did actually a study on this where we were able to detect minimum thresholds to detect salt and sugar and hedonic liking of different foods. And what we found quite convincingly was that fasting changes the way people feel about food. And that study will actually be coming out in the literature shortly. It's in review right now. So to summarize, I know we have limited time. Fasting decreases glucose and insulin and IGF-1, which is insulin growth factor 1. The higher your IGF-1, the faster you're aging. And that's true for humans and rats and all the animals that we study. Fasting lowers IGF-1. You know what else lowers IGF-1? Exercise. It's actually interesting. A lot of the things that exercise improves, so does fasting. We're going to see this over and over again. And the reason is, I think, quite interesting. Fasting and exercise have something in common. They both undo the consequences of dietary excess. And so the reason why exercise seems to be so health enhancing is on some of the same levels that fasting is, undoing the consequences of dietary excess. Fasting decreases the blood pressure and heart rate. It reduces mTOR, which is a mammalian target of rapamycin, and that's associated with increasing autophagy. Autophagy is where the body eats up the cancer cells and gets rid of the debris. Fasting decreases the microbial load in the gut. We talked about that. It reduces inflammation markers like IL-6 and TNF-alpha. It decreases inflammation and oxidation. It reduces the abnormalities associated with metabolic syndrome. It reverses metabolic syndrome. Now, interestingly enough, fasting increases adenopectin and ghrelin, which improve insulin sensitivity, and that reduces inflammation, which also may be why it helps so much in diabetes. It increases something called activated protein kinase, which downregulates PGC1 alpha, which is peroxisome periphylator activated receptor, and that increases what's called mitochondrial biogenesis. That's the production of the energy-producing components inside the cell, which may be why fasting can be helpful at overcoming some of these chronic fatigue issues. The beta-hydroxybutyrate, which is your primary fuel in fasting, stimulates something called BDNF, which is brain-derived neurotrophic factor. And brain-derived neurotrophic factor stimulates nerve growth and protection. It protects you from Alzheimer's and dementia. In fact, rats in a cage that are exactly the same rats, genetically bred rats, given the same diets, but one is given an exercise wheel and the others are not. The ones with the wheel will exercise, and they have a higher BDNF and they don't get Alzheimer's disease. That's why they discovered how exercise prevented dementia in rats. And it turns out the thing that increases BDNF is both, again, exercise and fasting. Fasting increases the sensitivity of insulin, so the insulin works. It increases what's called stress resistance and adaptation. What Walter Longo found is he took 30 rats, exposed them to chemotherapy to try to fight cancer. The problem is if you give enough chemotherapy to kill all the cancer cells, the rats all die. You have to kill all the cancer cells because if you leave any, they grow back. So then he took the same rats with the same cancer and the same chemotherapy, but he used fasting before and during and after the chemotherapy. Not only did all 30 rats survive, but he found there was dramatic improved effectiveness of the chemotherapy because fasting makes cancer cells more vulnerable because cancer cells don't have the same metabolism that regular cells do, and they don't like a low sugar environment, a ketogenic environment. And so it gives the chemotherapy a selective advantage at knocking out the cancer cells, and it also protects the healthy cells from the damages of chemotherapy. And this was, I'm not sure exactly how to say his name, but I think it's Yoshinori Oshumi won the Nobel Prize of Medicine in 2016 for his research on this issue of autophagy. And fasting definitely increases autophagy. It also increases the gut microbiome diversity, and it stimulates B-cell immunity. There's nothing that I've really come across that has such a diverse and profound effect on helping the body heal itself. And according to Walter Longo, published in Journal of Metabolism, the combination of fasting and chemotherapy results in dramatically higher cancer-free survival than chemotherapy alone. And when this study came out, a lot of the oncologists and a lot of the drug companies became very interested in fasting because they saw that it was a way to do their therapy more effectively. And fasting went from being criminal quackery to cutting-edge research. One thing they don't mention in these studies is the biomarkers associated with cancer turn off whether you do the chemotherapy or not. Okay, so I'm just going to, in the few minutes I have left, I'm going to go through just a few case reports just so you can get a feeling of what happens when this therapy is applied to patients. This was a paper that we published in the British Medical Journal in 2015, involved water-only fasting, an exclusively plant-based diet, in the management of stage 3A low-grade follicular lymphoma. This is lymph cancer. And this patient came to us. She was 42 years old. She had follicular lymphoma. She had excisional biopsy. It was tracked for 2 years. It continued to progress. She was eventually told that she'd have to undergo chemotherapy. You can see the size of her tumors listed here. She underwent 21 days of water fasting, 10 days of refeeding, during which time her tumors disappeared. She had a 2-month follow-up. We sent her back to the medical school. She had continued, as you can see, to lose weight by following a whole plant food SOS-free diet. Her initial neutropenia low white count eventually corrected itself. At 6 months, she had continued the diet, maintained the weight loss. At 12 months, we ended up doing another evaluation, found she was completely free of cancer. She had this follow-up. You can see the before. Here's the tumor here. or one of the tumors. Here's after fasting. Here's before and after. And ended up with a resolution. We published this paper in 2015, and then they invited us to do a follow-up. They asked us to follow this woman for 3 years in case perhaps she'd had a spontaneous remission or some kind of miracle. The question was, would she maintain it? And she continued to follow her whole plant food SOS-free diet. She maintained her weight, and in 3 years we were able to do another scan. You can see her whole body scan, completely free of any sign of cancer. And I might mention I've also have a 4-year follow-up on her now. She continues to do well. And so now we're tracking a number of patients with lymphoma, and interestingly enough, many of them appear to be doing quite well. We'll be publishing their case reports once we get their long-term follow-up data as well. This was another case report. This was a long-term relief from chronic post-traumatic headache. This was a dentist that came to us. She had been hit in the head by a pole, developed post-traumatic brain trauma, had a constant daily headache for 16 years. Every minute of every day, she had pain 8 out of 10 to 10 out of 10, every minute of every day for 16 years. Wasn't able to work. She'd become disabled. So we put her on a 41-day water-only fast, fed her for 6 months, and then put her on another 40-day water-only fast, after which time she had resolved her headache. I now have an 8-year follow-up on her, and she's continued to do well without any headache. This was a patient who had acute subacute appendicitis. Rather than go through surgery, which was what was recommended, we did fasting. We were able to resolve the appendicitis, and we have a 2-year follow-up that published, and managed to get that paper published as well. This one was a patient with hydronephrosis and urotectasis, partial regression of an unspecified retroperitoneal mass following medically supervised water-only fasting. So she had a tumor. They couldn't do the surgery for a month because the doctor was busy or something. So instead, what we did is we put her on a water-only fast. During that fast, she had a lot of, this was the tumor, this was the mass. So they couldn't tell without a biopsy whether or not it was a malignant tumor or fibrotic tumor. And so they scheduled her for this biopsy. Meanwhile, we brought her in and we went through 13 days of fasting and 11 days of feeding, because that's really all the time we had before she was scheduled for her biopsy. But during that time, she lost the weight, she normalized her blood pressure, she overcame her ureter inflammation and her hydronephrosis, and then when they went in and looked, the tumor had reduced to the point that there was nothing left to biopsy. And you can see before and after CAT scan. This was basically a person came in with a facial tumor, and you can see it here, this mass, and this is after fasting. And that was no surgery, it just corrected itself. This paper was published in Internal Journal of Disease Reversal and Prevention. And this woman had degenerative eye disease. She basically was referred to as she was legally blind. She'd had progressive problems with what's called Fuchs endothelial corneal dystrophy. And her vision was down at 20/200, ocular pruritus, photophobia, cataracts, blood pressure elevations. She was told she had to have a corneal transplant. And instead, what we did was we got her on a whole plant food SOS-free diet, and after 4 months, her vision recovered, and she went from 20/200 to 20/40 without correction, without even glasses. Her pressure's normalized. And we published this paper. This is a polypharmacy. This was a 80-year-old plus, I think 81. He was atrial fibrillation, ischemic cardiomyopathy, hyperlipidemia, high blood pressure in a gentleman over 80. He was told he was getting dementia and came in, and what we did is we took him off all of his drugs, got him on a good diet, and his memory loss, cognitive impairment, his fatigue, his weakness, his blood pressure all reversed. And we were able to publish this paper, Diet and Lifestyle Changes from Polypharmacy, because it turns out his drugs were what was actually causing his cognitive decline. As soon as we got him off his drugs, his brain function restored and reversed the condition. And so we managed to publish that paper as well. And you can see you know, the changes. And this isn't a guy who's in his 80s, but you see, you know, changes in these measures, just really quite dramatic. And this was not fasting. This was just actually dietary change alone. If you know doctors that want to do something worthwhile with their life and go to heaven instead of hell, we have an internship and residency training program. You can send them to us. There's no charge. We don't charge them anything. We've had a few doctors from Australia. We're hoping that, you know, some of them will actually get clinics opened up, so you'll have some resources there to offer good care. We have 4 books. The Pleasure Trap is our main book, Mastering the Hidden Force That Undermines Health and Happiness. And then there's 3 cookbooks available now that are vegan, SOS-free cookbooks. No oil, salt, or sugar used, all vegan, and good resources readily available through your Amazon.com. We do offer one service, and that is if you have a question, you want to know if fasting is useful to you, and you don't get a chance to answer it today or ask it today, you can complete registration forms on our website and call me, and we offer a no-cost phone conversation. I'll be happy to talk with you and let you know whether or not there's anything that fasting might be relevant in your situation, or if I have any other advice, I'll be happy to give it to you. And that, again, you can access our website here at truenorthhealth.com. Fill out the registration forms, and just I'll be happy to do that. I think I've probably run out of time now, but if we have any time left, I'll be happy to try to answer excuse me, any questions that you might have.
Thanks very much, Alan. That's fabulous. Just listening to that, I have fasted in my time. I've done a 21-day fast, but not for a long time. But just listening to you makes me think, yes, perhaps I should be doing it again.
Every once in a while.
Yeah. Yeah, I think that there are a couple of questions in the chat, I think, or comments.
Okay.
If someone has the MTHFR defective gene, will fasting give that person similar benefits to a person who doesn't have that?
Well, maybe even more so, because they don't metabolize and process materials quite as efficiently. They're more likely to have accumulated problems. And of course, it does affect, you know, you want to make sure that you're getting, you know, adequate methylfolate in your diet. You know, these diets are typically good in that regard. But if you have, there's many of these diseases of processing that can limit how efficiently you detoxify. All the more reason to eat well, live right, and use fasting effectively.
Fantastic. Is 1 day fasting per week a good idea?
No, I think 16 hours is what we recommend every day for everybody. And then occasionally, whether it's once a year or once every few years, you do a longer fast where you've got a good history exam lab and proper monitoring. I'm not sure that it makes a lot of sense to do these 2-day type fasting, because the most expensive part of fasting biologically is actually from hour 16 through, you know, the first 2 or 3 days. So you get a lot of biological price to pay without necessarily a lot of benefit. Now, you can do modified fasting where you put yourself on limited calories. Maybe you eat just raw fruit and vegetables for a few days. Lots of things you can do on your own safely and effectively, but water fasting really better done in a controlled setting, especially when you do longer fasting, specifically in patients that have health-related issues.
Mm-hmm. Would fasting affect Parkinson's?
Yeah, it's not enough to manage Parkinson's. In other words, we fast Parkinson patients and we get them on good diets and exercise and all that, and that's good. But in order to control Parkinson's disease, we also use L-DOPA, which comes from mucuna. And instead of using Cinemet, which contains cardopa, which creates the problems with Parkinson's disease, we use a protocol that's been pioneered by Marty Hines. And there's been a number of papers published by that. We have 2 doctors that have been trained in that protocol. And it's basically using mucuna, which is L-DOPA, with some amino acid supplements to control the nausea that comes from the mucuna. And if you do that, you can manage Parkinson's effectively without having to resort to the very dangerous cardopa drug, which irreversibly binds vitamin B6 and leads to long-term problems. So we can't manage Parkinson's without some exogenous support, and that support comes in the form of L-DOPA.
Okay. One of the previous speakers suggested we use iodized salt. You suggest we don't use salt at all. How do we absorb iodine, and are there safer and natural salt substitutes?
Yeah, well, you don't need salt at all, so we don't want to be added salt. And they throw some iodine on the salt because people that ate soils that didn't have any iodine in it were developing, goiters and problems. So if you want to include iodine in your diet, either eat food from soils that have iodine, foods that have at some time been covered by the oceans, or include some sea vegetables in your diet, a little bit of kelp, a little bit of dulse, or take an iodine supplement. You can do it any way you want to do it, but you don't need to poison yourself with salt just because they happen to use that as a carrier agent to get iodine into your body.
Right. Okay. Well, I think Australia has low iodine.
Yeah. So you may need to either include sea vegetables in the diet, a little bit of kelp or dulse, or take an iodine supplement.
Yeah. Excellent. Okay. We've been using coconut oil for cooking as a healthier and natural option. Appreciate your thoughts on this.
No, it's a bad idea. No oil. You can use soup stock or water. You can stir fry or steam fry, but you don't use oil. And coconut oil is probably as noxious as anything.
Right.
Here's a real simple model I tell patients. If you really, 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 really want something, you can't have it. Because you really, really, really want it, because it's activating the dietary pleasure trap. Now, that doesn't mean you won't enjoy eating. You will enjoy eating. And the longer you eat this way, the more you like it. But you don't get that drug-like effect that you get from those fried foods and some of this other stuff. So if you really want it, you don't get it because you get nothing.
Here's a question from Greg Fitzgerald.
Hi, Greg.
Alec fasted a few patients with CKD, though not severe. Have you seen patients successfully fast with 50% kidney function or less?
If creatinine levels are over 2.0, we don't do water-only fasting. It's real simple. If you can, there's a line where you can get improvement, but we're not going to use water-only fasting when there's significant kidney disease because it can get to be a real mess. And you need the kidney function at some level to handle the increased load with fasting. What we would do, though, is make the diet and lifestyle changes, maybe use modified fasting so that we don't exceed the kidney's capacity. Eventually, as the kidneys recover, you may be able to get into doing some fasting. And Dr. Burton was pretty aggressive. He was willing to take, higher risks than we would take, say, for example, in the United States. And so we have to have good outcomes every time. So we really focus on working with patients and in conditions that are going to have a good outcome and have a safe and effective response.
Okay. Is stevia a good sugar substitute?
No, it's terrible. The fact that even Coca-Cola, I think, realized that when they decided not to put it in because of all the cancer in the rats or whatever it was. What are you using stevia for? To sweeten up stuff you shouldn't be eating. So stop eating it. If you need to sweeten it up, you're making the highly processed garbage. Forget about it. So you don't need to put stevia on an apple. It tastes great. Or fresh fruit. You put stevia on some highly processed grain product that you've taken all the natural flavor out of, and now you got to try to pretend like it's some kind of health food.
Sounds good to me. Do the patients that do the long fast live in for these fasts, or do they stay at home?
No, they have to stay at the center. Here's the way it works. Patients come to the center. They're under the care of one of our medical doctors. They're seen twice a day by our staff doctors. They're brainwashed, or what they call educated. I call it brainwashing, with classes and lectures and all that stuff. They're fed a whole plant food, SOS-free diet. They're shown exercise, body use, yoga, meditation, whatever the heck it is that they need. And then we ask them when they go home to stick strictly to a whole plant food, SOS-free diet until we get our 50-year follow-ups. Once we get our 50-year follow-ups, then they're free to do whatever they want.
Sounds fantastic. If anyone, I had a look through your website today, and I'm sort of waiting to book my flight. There aren't any going at the moment, though.
Well, right now, nobody wants Americans. I think, they're building a wall to keep the Americans out, but eventually, maybe tomorrow we're going to have a new president. Yeah. And maybe he won't be so offensive, and maybe then they'll like us again, and we'll be able to play nice with our friends in Australia.
Mm. Yes, that'll be fun. There's a comment. Can you please clone yourself? And who do you think will win the US election?
I don't know, and I don't really care that much. I'm not sure how much difference it actually makes, whichever people they put into the presidential office. My feeling is that the people that make the decisions probably aren't necessarily the people that we see on the camera. But whoever wins, I hope it's definitive so that we don't get into these arguing about hanging chads and stuff like that. I hope they just can move on, and whoever it is will adapt and adjust.
another one, back to health. How do we ensure we get enough protein?
Well, the good news is it's not a question of getting enough protein, it's avoiding getting too much. There is no way to not get enough protein if you're on a whole plant food, SOS-free diet. If you ate nothing but brown rice and broccoli, you'd be getting a little bit too much protein, so you'd have to dilute it down with a little bit of fruit and stuff. So getting enough is not the problem. It's avoiding too much that's critical. And you do that by avoiding meat, fish, fowl, eggs, and dairy products in the diet.
Right, so plant proteins, it's unlikely that you'll get too much.
You can't, it's just, you can't eat a variety of whole plant food diets and not get enough protein in.
Right, okay.
Just doesn't happen. If you are calorie deficient, if you live on alcohol and processed foods, of course you can get into problems. We don't recommend that.
Yeah. Right, any other questions before we close the webinar?
So again, if anybody does have questions or people watch this later that didn't get a chance to ask their questions, they can go to our website, complete the registration forms, give me a call. I'll be happy to talk to them.
Right, okay. Right, well, I'd just like to say once again, thank you very much, Alan. That's been a fantastic presentation. Really, it was all put out there in, it's also logical. For someone who's been involved with natural health for 47 years, sure. It's second nature to me, I suppose, but it's always good to be reminded of some of those details and some of those amazing case histories that you gave.
Well, and once we get rid of all this COVID and stuff, I'll look forward to coming back to Australia. It's been 36 years since I've been there. I imagine there's a few changes now.
Well, we'll make sure that we get you at a at a seminar.
Absolutely.
Very good. Can I just introduce my husband, Roger, who's the health director of the Natural Health Society, who I don't know.
Nice to meet you.
Met him back in the dim and distant past. He actually attended a natural hygiene convention in 1972.
Wow, that's fabulous.
That was absolutely brilliant, fascinating to listen to you. And those of us who've done some fasting know exactly what you're talking about, exactly how effective it is. So,
well, thank you for keeping up the good work.
Actually, Roger was manager at Hopewood Health Retreat at.
I was so sad to hear Hopewood is closed down.
Yes, it's very sad.
Tragedy. That was absolute tragedy for a lot of people. So
it's a real. It seems like such a waste to have such a nice facility and not see it being fully utilized.
Yeah.
Yeah.
Yeah, such a waste. People would rather go on a cruise, I think.
Yeah.
Yes. Anyway, it's time to close the webinar. So once again, thank you very much, Alan, for your time and wonderful presentation, and also your offer for people to be able to contact you if they would like to ask more questions. That's the end of our webinar series. We are. Some of you will have received the Natural Health Society newsletter that went out the other day, and we're going to have an evening starting at 8 o'clock on a Tuesday evening, the third Tuesday of the month, I think, where people can get together and sort of just have a general chat and discussion. So some of us have been, after the various webinars, some of us have actually hung on and had a chat, and it was quite enjoyable. So we thought that might be useful for people. So until then, the 17th of November is the first one we're going to do. So that's a Tuesday evening at 8 o'clock. So if you'd like to join us, please do. You'll find the, I'm not sure, yes, in the newsletter, you'll find the link to it. And if you can't find that, give the Natural Health Society office a call and they'll be able to put you onto it.
It's also on the website.
Right. Okay. Right. So that's it's just a free gathering. It's Zoom gathering instead of getting together in person. So
you can actually register for it on the website.
Right. Okay. Thanks, Richard. Righto. So at this point, we might close the meeting. Thank you very much.